people walking in or joining online. But we've got 3 of us in here and about 4 more people online. And yeah, I think we're ready. I'm recording it, so anybody who wants to watch it later can see it then. We've got a pretty recent LMT graduate here, my TA from the BCST program, and a couple of my TAs from the CST program. And I'm not sure who everybody else is, but probably a wide range of folks in between. So here we are.
Okay, here we are. Okay. So thank you everyone for joining. I'm Carey Benenson Taussig, osteopath, traditionally trained in Switzerland and Canada. If I had to say, if I were specialized in anything, I would say I'd absolutely feel very comfortable in the world of visceral manipulation. But as an osteopath, we treat from tooth to toe, every structure, every living matter in the body. We work with the structural body, fluidic body, and electromagnetic body. So if, for example, we're working with the liver and we're moving the liver, and yet there's an energetic block, perhaps from trauma from surgery or something even ancestral, if we don't acknowledge the electromagnetic body, then whatever the body has asked for and whatever we've achieved in that treatment, it may not hold. So it's really important from our point of view to be able to recognize where the strain exists in the body. Visceral manipulation has changed my life personally, and I feel very comfortable in the fluidic realm of the viscera. And I'm very excited to come to the school and work with people who already have a trained hand in understanding, A, that the body is what will ask for help and what will heal itself versus us being the big healer, and understanding the biodynamic aspect of the physiology and the importance of touch as an invitation. And so coming from a very multi-layered training, I found myself really going back to my original roots as a human being and really learning to experience the viscera. So what's going to be really exciting about this program is that I'm going to be teaching what's recognized as a visceral spine. So we have a bony spine. We have, as you guys know, the core link, the craniosacral system. But we also have a visceral spine. And it's named the central chain by Philippe Drouel, who's the president of my college, Collège d'Études d'Ostéopathique in Montreal, is the mother school. But he named what's called the central chain as basically a visceral spine. So there are certain structures in the body that are supposed to resonate like a bell. And when something is touching the bell or is imposing any gravity that's imposing on it or postural influences, the bell won't ring. It will just thunk, thunk, thunk. So we're looking to invite these structures of the visceral chain to find their way home again so that they can resonate not only in their functionality as an organ, but also resonate frequencies and electromagnetic potency through the body. So this probably sounds complicated, but it's actually quite easy. It's just to basically understand the hand placements and then accepting and inviting the organ to tell us what we need to do. Do we need to talk to the covering, the connective tissue that surrounds the organ? Do we need to talk to the vessels that actually feed the organ and offer neural functionality? Do we just need to hold on and see what happens? All of that is very effective. So we're going to learn in this program how to really communicate with all different types of tissues and densities, but from a very feeling, meditative point of view. So what I'm looking to do is really work with people to understand that sometimes an organ actually does need a little bit of direct work. It might ask for a little bit of a stretch, what we call 50-50 reciprocal tension. So we might need to just ask whether it prefers direct work or indirect work. And if it prefers direct work, we're going to be working with just some simple applications on how to do a 50-50 stretch, or how to take something like the liver and compress it next to the lung, next to the right lung, comfortably using the exhalation to bring the two organs together, and then have the two of them communicate and sort of figure it out until one of them finally lets go. So that's more the direct approach. That's two approaches out of four that I'll be bringing. And then if it's asking for indirect work based on a big personal change recently, which brings me back again to my roots, I have come to understand that the best way to work, in my point of view with the viscera, from an indirect point of view, is actually to go into a meditative state where we are very present within ourselves as we're holding. There's a 50-50 dynamic of creating a lot of space between ourselves as a practitioner and the patient on the table, so that really not only can we hold a very centered fulcrum in a space of a relaxed midline, relaxing the pelvic floor, offering a half smile. These are ways to also get us into neutral space, while at the same time feeling their experience and holding their experience in a nurturing way, coming from the heart. So we will learn both a sort of direct approach to releasing strains in the tissue, or again, any living matter that might have to do with this particular organ or structure. And then the idea of how to recognize if we're being asked to do indirect work, and then really going into a deep meditative state. And the way that I like to teach is actually to really take the time, although I came from a training where we would learn the liver in 5 days and do over 100 techniques, which was very overwhelming and yet fantastic. I don't think that's necessary. Actually, we can slow down and really, I believe, through experiencing and really receiving the technique is how you're going to actually learn it. That's how I am as a person. And so I find that going into really deep treatment and actually really receiving the techniques is where the information will then come from. I think that really creating a space and also being a bit flexible with the curriculum in terms of what the group brings and what the group needs, and making sure that people do have their own experiences, that it's not just scholastic, but it's also experiential. I do bring a bit of continuum movement into the courses, where we're going to be using continuum sounds and learning how to explore both in ourselves and in the experience with the patient, how the choreography of the structure, maybe it's even a diaphragm that's holding the liver, how we might actually be able to help them experience the choreography that comes up from the body, and then helping them unwind or sort of dance their way back into correction. So this is very helpful, and some of the sounds are excellent to experience because the sounds of continuum allow the fluids between the layers of the fascia or connective tissue and the fluids within the organ to help move congestion, dryness, heat, all things that happen when the organs aren't moving properly. So if I were to start with what does this all mean? What are the basics of visceral manipulation? Essentially, through perhaps growth in the womb to falling down as a child or having a surgery, sometimes the organs can get small adherences between themselves. And we rely on 14 diaphragms in the body. As we breathe in, they descend, and as we exhale, they ascend. We rely on these diaphragms to really pump the organs and this visceral chain or this visceral spine to actually move in space. So if we breathe 24,000 times a day, we rely, the liver or the stomach that ride right below the breathing diaphragm need to rotate and twist back and forth in the way that they are supposed to. Axes of motion are discovered and determined when they actually develop as an embryo. So in other words, when we breathe in, our stomach rolls forward and sort of waves hello to the liver, neighboring liver on the right side. And at the same time, the liver will roll forward, side bend, and rotate to say hello to the stomach. And so if either one of them are blocked, then they can become fermented, heat, inflammation issues. We can see all sorts of gastrointestinal issues, etc. And so the idea is really to restore mobility, vitality, and motility, creating space for it to be able to move, to express its life force, and also to express its initial, both the movement of mobility, actual structural movement, and motility, which is more the embryological movement. So it sounds multi-layered, and it is, but all the techniques that we're doing are very experiential in the sense that we're just asking, what do you need? And seeing what the response is in our hands and learning how to follow that in ways that are just more ideas, so that each person can also bring their personal experience to the visceral manipulation technique. And again, bringing it in through experiencing it on the table, and both as a practitioner in the course. And with that said, I always bring in cranial work because we need to integrate that always into the core link. There are going to be assessment tools, and how do we find out where we're supposed to be? This whole complicated visceral chain, all these different structures, which we'll break down in different courses. But when we have 45 minutes with a patient, or an hour 15, however you work, how can we figure out where to go? And this is an important part of the teaching process, is to help people feel very comfortable about what they're hearing and where they want to put their hands, so that they feel that they are listening and able to arrive where the patient needs them to go. So we're going to do things like the icicle test, where we kind of shimmy people back and forth and see, where is the water not going? Where is the fluid stuck? Which quadrant of the abdomen feels a little cold? Where do we begin? This we're always going to be rediscovering each time. And we're also going to be doing some structural work to actually oscillate the neighboring bones. So sort of what they renamed as Traeger, we call general osteopathic technique, where we're actually going to work a little bit in the spine, moving back and forth in a fluidic way, staying in what we call the spring, to find out, oh, wow, is this part of the spine? Does it feel like wood? Is it gummy? Wood and gummy will mean two different things. Okay, well, that's also the level of the spine where if it's blocked, then maybe our kidneys aren't going to function very well, and it might even show up as knee pain. So also interrelationships are going to be important. And we're going to have a lot of time for Q&A in terms of what you might be seeing in your clinic, and bringing sort of case studies to review together and talk about how to think about it, and remaining really with the key point of view that the patient is going to tell us what we need. If we're not feeling something, it's probably because it's not available. That's not the entry point. It doesn't mean that we're not feeling. And that's one of the biggest challenges in visceral work. Gosh, am I really feeling the kidney? Am I feeling that ovary? And if I'm not, it's probably just means I'm not supposed to be there, or that's not the passageway or the entry point for that particular person, instead of taking it upon ourselves to say, I don't know what I'm doing. Because when you're in the right place, it will be very easy to feel. And most people that go away from the classes feel like visceral just became really easy. It just became very accessible. It just became very applicable to their current practice. If there's a naturopath that's working on the detox protocol, and the sphincters in the abdomen that open and close together are all out of whack, it's going to be hard for medicine to pass through. If the small intestine is blocked and it's showing up as lower back pain, that's our greatest area of absorption. So if we learn how to actually work with reinstating the mobility, motility, and vitality of the small intestine, then these wonderful protocols will start working and assimilating, and patients will respond. Depending on how receptive the group is, we will also consider bringing in some what I call brain talk, where we're going to work on helping those patients that are looping, they can never get better, finding ways to work through the cranium, actually the visceral cranium, to help their limbic system create new pathways, and working with that neuroplasticity, which is in the cutting edge of medicine now, helping them bring tools home so that when they're looping, that they're only getting worse and not getting better, giving them tools to be able to actually rewire some of those deep belief systems. So I'm going to open it up to questions. If anyone has any questions they'd like to ask.
Great. We have a couple of people in the room here if you'd like to step up and ask a question. And for anybody else who's joined us online, you can either unmute your microphone to ask a question, or you can write into the chat and we can see your questions that way.
Hi, did you say something about the visceral spine? Could you elaborate on that a little more, please?
Yes, so the visceral spine, or what was originally called the central chain by Philippe Drouel, who is the president of the Collège Études Ostéopathiques, where I attended. The visceral spine, or central chain, is basically from the top of the head down to the perineum at the base of the pelvic floor. There are certain structures that actually we look at almost like vertebra of the spine, where if they are out of alignment or they are adhered, there's an adhesion between that structure and a neighboring structure, then the whole system will be off. So we're going to learn what those structures are and how to find out which one is most blocked and how to free these structures, whether it's the lesser curve of the stomach is a very important area for the visceral spine. So is the thyroid gland and the tissue that attaches to the thyroid. We're going to learn different structures simplified in a way where we can actually look at this visceral spine as important as the back, and understanding how, if the visceral spine is out of alignment, it might actually be pulling the back out of alignment, or vice versa. If there's something wrong in the bony spine, it might be causing dysfunction in the visceral spine. So it's to think about, basically we have the spine, and then we have all these organs that hang off of the spine, and certain ones are very important that they're free, or the resonance in the entire body will not function properly or be translated properly. And it will be accessible, this information. It will be easy to understand where these structures are and which ones need to be free so that the whole person can function. It's very important, for example, people with autoimmune disorders. I did my actual DO, the doctorate portion of my education, on osteopathic techniques applied to patients with Lyme disease. And so I work with a lot of autoimmune diseases. I work with some of the sickest people that believe that they're sick, and yet it's considered, from my point of view, a stress disease, which is very controversial. But just to say that if we can really break it down to the visceral spine, learn how to communicate with it, learn how to identify those organs and connective tissue that make up this visceral spine, it can really be life-changing for our patients.
It looks like Robin has unmuted her microphone. Do you have a question, Robin?
I don't know if can you hear me?
Yes, we can.
Yes.
That was a mistake. I'm muting my microphone. I just have one request. I can't hear the speaker very well. She's like, her volume is much lower than the others. Could she maybe get a little closer to her microphone?
Okay, we're hearing okay on this side, so maybe I can send you the recording later if it doesn't come through more clearly. But thanks for the feedback. Carey, I was wondering if you could share with us all, for the mixed backgrounds that we have in here, if you could share with us all a little bit about what to expect in the first class and what kind of experience is helpful to bring into the class for people who are going to get started with you.
Okay, so the first class is really going to be about learning what is the visceral spine and learning how to open up the structural body so that we can access the visceral spine. So we're going to be using some rhythmic techniques, what is renamed Traeger, as I said, general osteopathic techniques, to oscillate the spine and just to feel where is it gummy, where is there a wood sensation, and then understanding how to link that portion of the spine to certain organs. In other words, it might be a gummy sensation in the spine if there is the visceral problem. Or there might be a visceral problem, meaning that the organ isn't functioning properly. If there's something really stuck in the spine, it would feel like wood. So we're going to learn how to really gently move in a fluidic way in the spring, rocking the patient back and forth both in sitting and laying down, to find out and understand the relationship between our bony spine and the viscera. So making those interrelationships, which is really important, because if someone comes in and they have something going on in their body, they have some sort of pathology happening, we're not going to be treating that disease, but we might say, well, perhaps you're having gastrointestinal dysfunction because your back is stuck. It's very woody, it's hard. And the nerves that enter or exit that area of the spine actually give functionality to the gastrointestinal system. So releasing the spine in a way where all of a sudden the organs might start working better. Isn't that amazing? Or maybe they start responding to care better. And the other way around, if somebody comes in and they have back problems, we might find, wow, this is quite gummy in the spine, and maybe it's gummy because there's an organ that's stuck, because the organs insert into the spine.
Carey,
So
I'm sorry, I'm going to interrupt you for just a moment because our meeting is about, we're about to get booted out of this meeting. So I just shared into the group chat another link. So anybody who is wanting to continue on